Good afternoon, everyone. I hope this finds everybody healthy and safe in an especially difficult time. We're resuming our Monday series of having faculty talk about topics that are related to COVID-19 and the legal system. Let me just tell you what's to come in future weeks, and then I'll briefly introduce today's speaker. Next Monday, June 8th, the focus is going to be a panel discussion with regard to race in policing. It's going to include Roxana Altos, Kara Bridges, Osagi Obasogi, and me talking about this enormously important topic. On June 15th, 2 weeks from today, Bobby Bartlett and Adam Sterling are going to be talking about COVID-19, the CARES Act, and small businesses. On June 22nd, Letty Volp is going to be talking about COVID-19 and immigration-related issues. And on June 29th, Ann Bloom will be doing a panel on the effects of COVID-19 with regard to access to civil justice. As I said, today's speaker is Jennifer Urban. I'm so delighted that she was willing to do this presentation. As always, just going to do a very short introduction so I can leave the time for her presentation. Jennifer received her bachelor's degree from Cornell University and a JD from Berkeley. She was the first fellow in the Samuelson Clinic. She then was a clinical professor at the University of Southern California from 2004 to 2009, creating the Intellectual Property Clinic there. She came to Berkeley in 2009. She's a clinical professor of law in the Samuelson Law, Technology, and Public Policy Clinic, and a co-director of the Berkeley Center on Law and Technology. Her talk today is about COVID-19, app-based testing, and surveillance policy. And with that, again, thank you, Jennifer, and I'll turn it over to you.
Thank you very much, Erwin, and thanks to everybody for joining us today. I know we all have a lot on our minds and many other things that we could productively be doing. So I very much appreciate you taking the time to talk with me about contact tracing apps for COVID-19 surveillance. Just give me 1 second to share my slides with you. Hopefully it will. So I have, today I'll be talking about the law and policy of COVID-19 contact tracing apps, but that is really a very grand title because as of June 1st, 2020, this is a partial picture of a very complicated landscape. It will change tomorrow, it will change next week, and the asterisk rest is very much necessary. But what I'd like to talk with you about today is what these apps are. You've probably seen something about them in the news, what the intention behind them is, and how we might best analyze them and decide what characteristics they should have in order to have good public health results, as well as being protective of civil liberties, privacy, and other interests. They've been in the news a lot, just generally speaking, but also in the world, in sort of my research world and my colleagues at BCLT and the Samuelson Clinic. These have been a very large and vociferous topic of conversation for some time. It has the idea of doing automated tracing of COVID-19 infection has resulted in a multiplicity of views in the privacy and civil liberties scholarship and advocacy community. And there have been many analyses and thoughts, but very few sort of final answers. This situation for people in that particular community feels a lot like the situation after 9/11. This is a genuine emergency. It's a public health emergency. Collective interests are paramount in many ways. And for those reasons, some of the individual interests that we're accustomed to maximizing in Western society, and perhaps particularly in the United States, fall by the wayside appropriately in order for collective interests to be protected. At the same time, an emergency situation can result in quick decisions, lack of care in how things are developed, and something that changing the legal landscape, the relationship between citizens and the government, between consumers and companies, and so forth, in ways that are very difficult to change later. It becomes quite difficult to pull back some of the changes that we put in place after other emergencies. For example, 9/11. We have a much more robust government surveillance state still this many years on after 9/11. So we have a lot of competing interests here, and they are very legitimate interests. Why are we interested in automated apps to begin with? Well, let me just go into sort of a little bit about what they are to help explain that. So what are COVID-19 trace and exposure notification apps? In short, the idea is to automate traditional contact tracing for infectious disease in some way. And there are many versions of them. I'll give you a few examples, but that's the basic idea. We are in a situation where we have well over 300,000 confirmed deaths from COVID-19. Of course, that is a huge undercount. And we have millions and millions of infections. And as a country and as a planet, we haven't been able to get on top of this pandemic. Of course, we are all doing this conversation from home, remotely. There have been tremendous economic effects from trying to contain the virus. And it is a particularly difficult public health problem for a number of reasons. One is that it is worldwide. There is sort of no limit to where we might need to be tracing cases in order to try to contain the disease. Another is that it is widely as a virus. It is infectious before people are symptomatic. Sometimes it is highly infectious, generally speaking, and it is a respiratory illness that can be passed on both through droplets, possibly even aerosols, and through foam-like surfaces. It's really difficult to get a handle on. And so if we are able to develop tools that can help with that, that would be a public health boon. In order for us to get back together in person and for people to be able to get back to work, our state, California, and other governments around the country and around the world have stated that we have to have do a better job of testing people for disease, tracing the contacts that they have in order to understand whom they might have infected, and to isolate infected cases and support those who are positive and exposed. That is the traditional, longstanding, well understood way to contain an epidemic. And traditionally speaking, it relies on in-person contact tracing with public health officials being notified of a reportable disease, calling the person who is infected, talking with them about where they've been and who they've seen, calling all of those contacts, and thereby tracing out where the disease is and trying to contain its spread. This is a well understood process. There are very good best practices in place. We know how to do it in general, but it's also expensive. It requires a lot of manpower. It is indeed invasive. It asks a lot of people who are talking to a government official to tell this person where they've been and with whom they've been in contact. It is difficult in a number of ways beyond that just general perhaps hesitancy that someone might have talking to a public health official. For example, in California, we have dozens of languages and we don't have enough contact tracers who speak different languages in order to be able to talk with people. People might feel a sense of stigma. They might feel a sense of embarrassment. And of course, their memories are fallible. So for all of these reasons, while contact tracing, in-person contact tracing is a known quantity and it does work very well, it has a number of limitations. This is where the idea of these automated contact tracing apps comes in. This graphic is from a paper that was published in Science a week or two ago that makes an argument for an app like the ones that I'm going to talk about that would automate a lot of this contact tracing. And there are some important aspects to it. One is that it would require a lot less of the infected person memory. So we have person A who's positive for COVID-19. That person is carrying a device around with Bluetooth. That's mostly what we're going to be talking about, turned on. And as they move around from home to the train, to work, back to home, their Bluetooth, the Bluetooth application on their phone is talking to all of the other devices that are around them. So it has an interaction with the other devices, which I'll describe a little bit more, so that when the person wakes up the next morning with a fever, what they can do is report that they are positive to that app, and it can automatically inform everybody who is close enough to the phone for them to be at risk of infection, so that they can take measures to be tested or to isolate themselves, to quarantine, or whatever we decide the best public policy response is in this situation. The idea behind it is that it is automatic and it is fast. And the little graph in the middle right corner there, it says growth rate, explains why it is so important for this particular disease for notification and isolation to be fast. I'll talk about that a little bit more in a minute, but I wanted to give you a heads up about that being an important characteristic of successful contact tracing for this particular disease. So how do the contact tracing exposure notification apps work, excuse me, and what do they look like? So the first thing that's important to understand about them is that there is an absolute welter of options right now. There are a number of academic groups who started putting specifications and software together. There are a number of private companies. There are a number of governments that have put various things together. And so there are far too many to go into detail about all of them, but I'll give you a couple of representative examples and then spend most of the time talking about the one that seems to be gaining the most traction, which is the Google Apple app. There are some important characteristics of these apps to understand. One is that they are smartphone based. In theory, people could use tokens or other devices, but these are all smartphone based. They are intended to be complementary to the traditional tracing and notification that I was talking about. They are not intended to replace it. And they have some key distinctions, which we will go into as we walk through some of the characteristics of the different examples. Google and Apple, for example, have created an API. You can think of that as a standard. It is something that allows governments or companies to build applications that you will actually use according to the specifications, such that they can talk to the relevant servers and they can talk to each other, but it is not itself an app. Some of the other ones are just applications that were created for you to download on your phone. They use different kinds of protocols in order to try to trace people. GPS gives you location data, but it isn't very close, and it doesn't. It only really works outside. Bluetooth is the protocol that your Bluetooth mouse uses and your Bluetooth keyboard, and you may use it on your phone for various things. It is close proximity, low power communication, and it has become the most popular. Wi-Fi is another option, and some of them use a combo of these things. This is important because they have different strengths and different weaknesses, and they have different ramifications for interests like privacy and government surveillance and tracking. GPS tracks location. Bluetooth, or at least the Bluetooth APIs and apps that we are familiar with, tracks proximity. It means that all it does is your phone tells you that you've been near somebody who was positive, or it tells them that they've been near somebody who was positive if you are. It doesn't say anything beyond that. It just says that you were proximate to a positive case, or that you were not. Other kinds of data that are collected is important. What are the relevant inputs? You have to have a positive test. Do you have to have a public health official who gives you a token before you put in that positive test? Or do you just report symptoms? And that would result in others being notified that you are positive. Is it voluntary or is it mandatory? Of course, that's a very big question. Is it a centralized system or a decentralized system? Meaning, is the relevant data kept only on the devices or mostly on the devices, or does it go to a central repository? And then, of course, who's in charge of that repository and what do they do with the data? And what is the role of government versus and/or private parties with regards to the app and/or the data? So let me talk through some of the issues here by giving you some examples. As I said, there are a welter of these apps. This is a MIT Technology Review is tracking them, and it has 30 currently on its spreadsheet, as you can see. This is not all of them. There are more every day, and there are a number that, for example, are being considered or have been partially implemented or implemented by states in the United States that are not on here. They have a number of these characteristics captured here. Who's in charge of it? Is it the government or is it somebody else? What is the technology behind it? Is it voluntary? Is it centralized or decentralized? And the question of voluntariness and centralization or decentralization have turned out both to be very important. As you can see, almost all of these are voluntary, meaning that nobody has to download the app. Nobody has to report anything according to law. Under some kind of government authority, it is the choice of the citizen. The only exception out of the democracies of India, and then there are some less democratic countries, but not very many, that do not have it be voluntary. There's a pretty even split between centralized and decentralized, and that is whether the data goes to some central point that is kept by a health authority. For example, the NHS in the UK wants to have a centralized point where the data goes so that they can protect it. This is how they see it, and so that they can use it for various things. A lot of security and privacy advocates prefer a decentralized model where the data doesn't go to one place where it could be vulnerable or more things could be done with it. A couple of specific examples. Singapore is very famous at the moment for, well, generally for having been able to successfully quell SARS and MERS, and now it has done a pretty good job of quelling COVID. It has what's called the Trace Together app. In fact, although it's Singapore, this is voluntary, but it is paired with surveillance by the police and lots of other methods that Singapore uses. South Korea similarly has a variety of things that it uses. This is one of the few countries that is not voluntary. It's not voluntary. If you come into the country, you do have to download things and you do have to give information to the government. They pair that with credit card information and CCTV information in order to track quite closely where potential or infected cases might be and to notify the public. And they have managed to, with some hiccups, they have managed to really quell transmission in South Korea, but it is at the expense of a great deal of information both collected and to some degree disclosed to others. In the United States, a variety of states have done a variety of things. I won't talk about these in detail, other than to say, for the most part, they are partnering with a private company in order to create these apps. They do a number of things. There aren't that many so far that actually do contact tracing. Some of them do more survey and communication with the health authorities to get information about, to assist human tracers who are doing their jobs. And the Google Apple API, I'm going to talk about more in a minute, is, as it is with European countries and other countries, it seems to be sort of gaining a little bit of traction, but it was only released last week, so they'll have to see where that goes. There are also examples of companies trying to sell these apps or selling these apps for private entities. So PricewaterhouseCoopers has one that is aimed at tracking employees so that you are able to see the proximity between employees and thereby hopefully be able to identify people who might have been exposed at work. Salesforce has a broader sort of dashboard of information that it is marketing both to employers and to governments, for example, state governments. The idea is that it will collect a lot of data and be able to help the employer or the state have good information about what the outbreak, if there's an outbreak, looks like in that location. They actually don't promise contact tracing yet. They say that it's coming soon, but they are pursuing government and corporate partners actively. And then there's us, there's Berkeley. We actually have, this is the only example I've been able to find of this particular app. This is an app that is by a local company that was spun out of the Sudarja Center. It was part of their incubator, I suppose, that does a lot of Internet of Things, device-to-device communication. And like so many of these other organizations and academic groups, they came up with a decentralized, anonymized app that they have. It's unclear to me exactly what the status is, but certainly one of our city council members is positive about it. And it may be that this is the app that Berkeley decides to use, the city of Berkeley. I don't know about the university. But it is unique as far as I can tell. I don't know if anyone else that might be using this app. Okay, so Bluetooth is what we're going to mostly focus on for a couple of reasons. One is that it is widely considered to be more useful for proximity tracing than GPS, because of the fact that GPS doesn't get very close. And secondly is because it is widely thought to be more privacy protective than using location data, where if it goes to a centralized location, whoever's in charge of the centralized location will be able to see exactly where people are, or if there's a way for that data to be collected and shared, others would know where a person is. So the Bluetooth data doesn't have that kind of detail about location, at least as most of the apps use it. So it is the most popular. And I'm going to especially focus on this Google Apple API that I've been talking about. Google and Apple have together over 90% of the smartphone market. So already they have a big advantage in having the kind of installed base that you would need in order for a location tracing program to be effective. They have gotten together in order to launch an API that public health officials, they are limiting it to public health authorities for now, can use to build applications that people in their countries or in their states can download in order to do some of this automated testing. So I'm going to briefly talk about how it works. The important thing about it is that it's intended to be relatively accurate, which we'll talk about a little bit more in a minute as well, and privacy protective by not revealing more information than is necessary. And it uses some pretty clever cryptography to do that. So the idea is that Alice and Bob, these two people, they're talking to one another on either end of a park bench. They are within the danger distance, I suppose, and each of them has a phone that has an app that uses this API on it. While they were talking, their phones exchange anonymous identifiers. Those anonymous identifiers actually change on a regular basis. This is important because it helps keep the data anonymous, or is harder to break the anonymity of. And they are simply strings of numbers. They're anonymous tags. And then once a day, they exchange another tag that says whether or not someone is infected. And all of this information, they exchange this information and they go home. And then the next day, Bob is positively diagnosed. So he has a choice at this point. Does he decide to tell the app that he's been positively diagnosed? It is voluntary to download the app, it's voluntary to turn it on, and then it is voluntary to disclose to the app that he is positive. So he decides to disclose to the app that he is positive. His phone then takes the last 14 days of those identifiers that they've exchanged, his keys that identify him uniquely, but give him a unique identity, but an anonymous one. And those are uploaded to the cloud, to a server that keeps track of positive cases. Then we get back to Alice. So Alice has been going along with her phone, unaware, of course, that she has interacted with somebody who is positive. Her phone talks to the server and it downloads a notification that says she has been proximate to someone who's tested positive for COVID-19. She doesn't know anything else other than that. Her phone has simply been periodically downloading all of the broadcast keys of people who had tested positive. And so she knows that she needs to do something. Maybe she needs to be tested, maybe she needs to self-isolate, but she has the information that she needs to take the next step. This is the idea, at least, behind these sorts of Bluetooth apps, and Apple and Google in particular. So there are some important privacy protections here. The data only goes to the server in order to do the matching. For the most part, it lives only on people's phones. They only exchange those anonymous beacons. The beacons are changed in order to both maintain anonymity and to make it more difficult for bad actors to attack by intercepting the Bluetooth signals and pretending to be Alice or Bob, for example. And in theory, she gets enough information to do what she needs, and it happens automatically and quickly without the need for the much more detailed information gathering and labor-intensive work of traditional contact tracing. So how do we decide if this is a good idea and if it's worth the cost? There are a few things that we could consider. I'm going to consider at a pretty high level, because there are complicated questions for each of these sub-questions, whether we think they meet our societal requirements. Now again, we are in an emergency. This is a situation where we want to maximize the collective interest and be able to quell the virus. We also, however, need to know if what we're doing meets legal requirements, if it is actually efficacious at meeting public health needs, and how it compares to social and normative values. The reason why these apps have been such a topic of conversation in the privacy and civil liberties world is because there are things about them that raise questions about the trade-offs between the potential public health benefit and privacy and civil liberties detriments that could ensue. So let's start with the legal frameworks. I won't talk about these in much detail. for one important reason, which is that currently almost all of the tracing apps are voluntary, and they require consent. You are not required to upload them, you are not required to turn them on, and you are not required to share any information. You must affirmatively consent. And that by itself is often, particularly in the United States, enough that we don't have an issue with a lot of the relevant laws. But leaving that aside, there are a number of relevant laws to think about. One is HIPAA, of course. A lot of this data is going to be shared with entities that aren't covered by HIPAA. The information about whether or not you're positive for COVID-19 is a reportable disease, right? This is a public health activity, and there are exceptions for that. And HHS has waived certain portions of the HIPAA privacy rule in light of the public health emergency. There are state laws that could cover some of the information depending on what's collected, where it's kept, and how long it's kept. Our own California Consumer Privacy Act. The Illinois Biometric Privacy Act, actually, because a few of these apps actually do collect biometric data or are considering it like a face or a fingerprint. Breach notification laws, if the data does go to a central place and it is the subject of a breach. The Americans with Disabilities Act, if you're an employer, for example, and you are using one of those platforms and you're collecting data, that might be implicated. The FTC Act for a variety of consumer protection reasons, and a number of state bills and a couple of federal bills that we'll talk about in a minute. The Fourth Amendment, again, unlikely to apply because so far everything is voluntary. So even if the government is a central repository of information, it's voluntary, we've consented. If there were the case that it became involuntary, then we might consider questions like whether it's location data, whether these kinds of apps could constitute a search and that sort of thing. But for the most part, we're not in the realm of the Fourth Amendment. Interestingly, Europe and the UK have had pretty similar evaluations to the US here. The General Data Protection Regulation and the e-privacy directive do have carve-outs for public health emergencies, as most laws do, but the European Commission and several of the member states have issued guidance that the apps that they are considering or implementing also must be voluntary. They need to rely on proximity instead of location, and they require robust consent. There's disagreement within the member states over whether or not a centralized system, which has potential benefits for the public health authorities, and at least France thinks that they can protect the data more effectively if it's centralized versus decentralized systems that cryptographers and a lot of privacy advocates like. The European Commission likes decentralized systems, so does Germany, Austria, Spain, and Switzerland, but France, Italy, and the UK want to centralize. And this raises one of the questions on the earlier slide, which is the role of private companies versus public health officials. So France has been in a debate with Apple about whether or not they should be able to use the Apple-Google API yet centralize the data because Apple doesn't allow that. And Google and Apple have set up these specifications and requirements and the policies around their API so that you can't do that. But it looks as though some of these, France perhaps is going to consider a version of the Google API. So the legal issues are, I wouldn't say 100% straightforward, but they're not as complicated as the social and normative issues around these applications. Public health, of course, was the second on my list in that it has to be efficacious for public health. But having the apps be efficacious for public health actually overlaps with a lot of the question around social and normative issues more generally. So I'm going to talk about them together. When we think about surveillance in an emergency or in any situation, but particularly in an emergency, when the government or others are looking to have more powers or to collect more data, there are a number of questions that can be asked. The number one question is, will this actually work? Could we quell the virus or make a significant positive difference or a meaningful positive difference by using these apps? And does it matter what they do? Does it matter, how much information they collect, what kind of protocol they're using? But would it be efficacious? And then, if it is efficacious, what are the trade-offs that we are considering? We are considering some trade-offs because we're sharing data that we wouldn't otherwise share. Do we consider them to be acceptable? Are there other harms that we might be trading off? Are there equity issues, non-discrimination issues? I'll talk about those in a minute. Or have we decided that this is an acceptable trade-off? And then if it's an acceptable trade-off, are there sufficient protections? This is where things that are decided in an emergency situation or in a crisis situation or an extraordinary situation can be difficult to walk back. They can have mission creep. And so civil liberties advocates look for backstops or guardrails around what we've decided to do. We look for transparency, community participation in order to understand actually how people are experiencing things and if it's working for them. Minimizing the data collected if we're talking about data surveillance, security around that. Again, equity and non-discrimination protections, oversight and enforcement of that oversight, and importantly, time limitations, sunsets when the emergency has passed. Section 215 of FISA from after 9/11 just expired. Although it had a sunset provision in it, it's been renewed multiple times. And just now has Congress let it expire. They will probably renew it again, but they are debating it. So even if you have a sunset provision in changes that you make in response to an emergency, it can be difficult to walk it back. So it's always important to keep that in mind. A number of privacy scholars and advocates and organizations have put together best practices to address particularly number 3. What could we do to design something if we assume the other 2 are okay in order to have an acceptable trade-off? And our own colleague, Paul Schwartz, has put together a sort of he sort of collated together best practices from the European Commission and ACLU and EFF that are the sort of traditional things that are required and that a lot of privacy experts think should be required for these apps. And then there are actually members of Congress are looking to potentially regulate this kind of tracing. So the Republicans introduced a bill on May 7th, and the Democrats answered it with a bill on May 14th that deals with app-based contact tracing data and some other kinds of data. And they're very interesting bills in part because they are some of the strongest sectoral privacy bills that I've ever seen. So they have some shared characteristics that are all aimed at making sure that those backstops are in place. They cover health data of various sorts, including proximity data, which is a brand new idea in privacy law as far as I know. Both of them require that sharing data would be voluntary and that there are strict consent requirements. There are minimization requirements, don't take any more than you need, security requirements, use limitations. All of these are things that privacy advocates have asked for often but have only more recently started to obtain. So they're very sort of strong protections in a lot of ways. They do have big differences in some things that could be important. So some of the definitions are different. You know, the Democrats' bill tends to cover more things and be generally a little bit more protective. The Republicans' bill has more exceptions for employers, for example, but it also doesn't cover government actors. The Democrats' bill has a private right of action in addition to FTC enforcement and prohibits mandatory arbitration. The Republicans' bill does not have a private right of action. And the Republicans' bill actually preempts state laws and FCC regulations, whereas the Democrats' bill does not. That is a big difference. And interestingly, the Republicans don't sunset the preemption. So the ability to share the data and all of the rest of it sunsets after the health emergency is over, but not the preemption. I bring this up not because I want to talk a whole lot about the details, but because I want to point out two things. One is that the officials are taking this quite seriously. They are really looking to craft some protections around this data. And the other is that they're very much focused on, again, are there sufficient protections for sharing this data and using these apps? And that I want to point out because we've skipped over a little bit efficacy, which happens a great deal in this kind of situation. It's very easy to skip over the first question, which is whether there's efficacy. But without efficacy, we shouldn't get to the other questions. There's no point in actually engaging in the rest of the conversation because it isn't going to meet the goal that we ask for it anyway. So why would we move forward and incur whatever costs to civil liberties or privacy or equity that we would otherwise incur? So let's talk about efficacy a little bit. In order for the transmission rate to be below an R0 of 1, which I'm assuming at this point everybody's pretty familiar with this concept, meaning that the epidemic is controlled because the number of people infected per person and the transmission rate have sufficiently slowed down, you need to get a surprisingly high percentage of contacts to be traced. And you need to trace them quite quickly as well. But what this graph shows is simply that in order to quell a highly transmissible infectious disease like this, with an R0 that is somewhere between 2 and 3, maybe, sometimes it seems to be higher. Of course, if we're all staying home, it's lower. You need an infected person's contacts to be traced at a very high level. If it's 2, you've got to have 70%. And if it's 3, you need to have more like 90%. This is a graph from a paper in the Lancet that is based on a model. So it is a projection as opposed to using real data. But because they're simply using the known behavior of infectious diseases with reproduction rates like this, I think that it is a valuable model. And it is a sobering piece of information that it needs to be that accurate. The other thing that is very sobering is that for this particular disease, it seems that contact tracing and isolation of isolation of cases, contact tracing, and then isolation of people who are contacted needs to happen very fast in order for the contact tracing to successfully, again, quell the disease by reducing the transmission rate sufficiently that the epidemic slows down or stops. Now, this isn't my graph, but I feel like I need to apologize because I find that it's a little bit confusing visually, and I'm sorry about that. It's really easiest to start from the right side of the screen. If there is no delay at all, if we have a magic world where someone is diagnosed and instantly everyone that they've had meaningful contact with knows, then you need to have about 60% success in isolating, in identifying contacts and isolating cases. And you can see that simply by looking at the where the points meet between the X and the Y axis. The lines are, the middle line is tells you what the cutoff is for the epidemic being reduced or the epidemic not being reduced and continuing. And the dotted lines tell you again what the R naught is. So if you have no delay, you still need a pretty high percentage, but it's pretty reasonable. Once you have 1 day between someone being diagnosed and contact and quarantine, you need to have a much higher success rate. And then if it's 2 days or if it's 3 days, suddenly it becomes very, very difficult to get the disease under control through contact tracing. This is one reason why, at least in theory, these apps can be really attractive. Rather than having somebody have to go through a bunch of manual information and make a bunch of phone calls, in theory, it could happen quite quickly. And we could get the benefit of that by using an automated app. So this graphic, in fact, is from the same paper that these graphs are from. It's a paper in Science from a couple weeks ago that actually uses historical data in order to try to figure out what the requirements are and whether an app would be a good idea. They conclude that it is. So in theory, it could work like this. Bob is infected. All of these contacts that he's had are identified through the app, and everybody can decide to make a decision or can decide to be tested or to isolate themselves. And we have really improved the epidemiological situation without sharing a tremendous amount of sensitive data or creating much of a security risk. But here's the rub. This happens if the Bluetooth app is installed by default. If everybody has it and it's always on. And we know from previous information that almost every situation is voluntary. That we have assumed that that is all that would be acceptable. And what we know from countries that actually have some apps actually working is that the penetration rate, that is the rate at which people actually agree to download the application, is quite low. Even in Singapore, it is still under 30%. And we know from the previous slides that we need a much higher rate than that if this is going to be useful. The person who did the little dots with Bob made some guesstimates about this, which are fairly reasonable, I think, but it is a guesstimate. So if 90% of people have a smartphone and 30% download the app, 27%, I think he was going off of Singapore being 25% at the time, and then a slightly lower percent open it, and still a lower percent set it up, and then still a lower percentage keep their Bluetooth on because, you know, it kills the battery. And there are problems with some of these apps that they don't run well in the background, etc. You get all the way down to this and you actually are only getting a small handful of contacts are really actually being identified and in his scenario handed off to investigators. And so, you know, it could be 5%, it could be 10%, it could be less. But with a voluntary app, there are real limitations to how effective it can be. And his numbers are actually a little optimistic. 81% of US adults have a smartphone. Remember, you need a smartphone for this. And the demographics of people who have smartphones vary, and they vary in ways that are important for equity and for fairness reasons, and for public health reasons. People who are over 65, only 53% of them have smartphones, and they're one of the most vulnerable groups. People who have less than a high school education, 66% of them have smartphones. People who live in rural areas, only 71%. And people who make less money also have a lower, they're less likely to have smartphones. But they're also more likely to be in jobs that require them to go out. They're considered essential, or they have a job that they can't do from home. So they may be more vulnerable, but less likely to be able to take advantage of the potential benefits of the app. So we have both an efficacy issue here and an equity issue here. Secondly, there are a lot of efficacy issues with Bluetooth itself. I won't talk about them all so that we have some time for discussion, but you've probably experienced this. I have a Bluetooth mouse that is constantly locating my laptop when I'm on another floor, and at other times it loses the thread completely. That's because Bluetooth has trouble if there is a lot of water, which your body has a lot of water in it. It can be thwarted by walls, by what the orientation of the device is, and all kinds of things. The protocols themselves and the applications have limitations. Some of the current instantiations, you actually have to have the screen on all the time for it to work, and that's not going to work. The beacons are traded only every 15 minutes often, which, you know, if you're in contact with somebody for 10 minutes, that's not going to do any good. And so you can get a lot of false positives and false negatives, which both reduces the efficacy epidemiologically and can cause a lack of trust, making people less willing to upload the app, less willing to use it, less likely to add to the benefits by agreeing to use it. And so, kind of unsurprisingly, contact tracing apps are off to a slow start. Now, part of this is because they're still being developed. It's only been a couple of months, but part of it is because there is some doubt around it. In North Dakota, there's not a lot of uptake. South Dakota has the most uptake. 2% of the population has downloaded the app. Again, you know, they're really just getting started, but we don't have good facts so far. California is trying desperately to increase testing because that is another piece of the puzzle that has to be in place for any of this to be efficacious whatsoever. And right now, we simply don't have enough testing in order to have identified enough positive cases in order for us to be able to quell the outbreaks very well using these kinds of apps. So what do we do with all of this? Privacy and scholars and advocates have had basically sort of 4 reactions that I can see, and others may disagree with my characterization of this. But one is the game just isn't worth the candle, right? Number 1, efficacy is most important. And this isn't effective enough to make much of a meaningful difference. And that means that we're just going to be spending resources that could be spent on more efficacious and perhaps less invasive interventions that we should be doing that. Second group is skeptical. They think the jury is still out, but they are focusing on improving outcomes and reducing harms. They would only consider decentralized, voluntary, as anonymous as possible, time-limited options like the Google Apple API. And they're focused on making sure there's transparency, minimization, involving the community, preventing discrimination, and that kind of thing, and that there's an expiration of the process after the emergency is over. I would put ACLU and EFF in that camp, along with a number of others. Then there's the, you know what, why the heck not? This isn't actually that risky. Sure, it's got limitations, but maybe it'll pick up a few cases. And we know that if you pick up a few cases and you can cut off even one of those branches, it's helpful. And then there is the group that says, you know what, it isn't actually very efficacious and it has to be efficacious. And so they would double down and they would improve efficacy by reconsidering the privacy values. Number one would be to make the apps involuntary. Number two would be to collect more data. If you put Bluetooth and GPS together, maybe you get more useful data. Another would be to centralize all of this with controls over what data controllers could do. And indeed, Jane Baumbauer et al. Goes so far as to say, buy everyone smartphones and watches. We should just ship them to everybody in the country to deal with the differential there and spend a lot more on testing. So there's a real range from people who often agree, depending on what values they're maximizing and what risks they think are worse. Where do we go from here? I can't say that I am sure because things are certainly very fluid. There have been some not unsurprising complaints about some of these. This is a private company app, and another private company found that it was actually collecting more than it was meant to and sending it to Foursquare and Google. Just yesterday, a privacy group sued the NHS over their scheme. And in the meantime, cyber intelligence firms like Palantir and others are saying, forget it, you should just forget this kind of privacy protected thing and you should be engaging in real surveillance. And we have some real broader public policy questions already to consider. Are we going to use will these apps be sufficient to replace some other more invasive things like contact tracing lists at restaurants? And could the information be used for something else? So I do not think that Commissioner Harrington was actually trying to say they would use COVID tracing apps, but he compared it directly to COVID tracing and using apps in order to figure out who was in proximity to protesters at the protests over the last couple of days. So we know that these questions are real, and we know that they're difficult, and that we have to make good decisions as a society. Thank you. I want to thank Jim Dempsey, who has also been thinking about this a lot, and my wonderful research assistants, Jennifer Chung and Jia Chung.
Excellent. So if you have any questions, you can raise your hand or you can type it in the chat, either to the group or you can send it to me privately and I'll read them out loud to Professor Urban. So 2 questions. One I think is an easy one. Will the slide deck that you use be made available to people who are listening, Professor Urban?
Sure.
Great. So if you want to send it to me, feel free to email me and I'm happy to share it with people.
Of course.
All right, by utilizing Bluetooth technology for these contact tracing apps, what is the risk of exploit/hacking for users' phones? Do these apps operate by continually keeping a Bluetooth tunnel open on the app user's phone? How high are these risks? And what is the likelihood of a successful exploit of a user's phone by using one of these apps?
This is an absolutely wonderful question. It's a complicated question with a complicated answer and a number of unknowns. So one of the reasons why the keys are changed all the time is an attempt to make it less easy and less worthwhile to try to get into the middle and intercept that Bluetooth signal and then do spoofing, for example. Another big challenge with some of these apps that Google and Apple try to reduce the risk of is simply people just trolling. So uploading a positive case to the app and thus to the network of everyone they've been around in order to create panic or to make it, maybe you're 10 years old and you want to stay home from school all day. It could be anything. By requiring public health authorities to give a token for somebody to say that they're positive. That's an attempt to deal with that. That said, there are some exploits that are still possible that I think would take a long time to explain and I might well get wrong. So if the person who asked that's in the chat, let me know and I will email more information. So the short answer is, yes, they are possible. The risk has been reduced quite a bit compared to other forms of app tracing you could do.
Great, thank you. Dean Chemerinsky, I think you have a question.
Jennifer, that was wonderful. Thank you so much. I have two interrelated questions. One goes to what consent means in this context. If the University of California says that students and faculty and staff can come back only if they have this app, is that meaningful consent? And I can imagine employers or schools requiring this. What does consent mean in that context? And then the second goes to, if it's not consent, then the Fourth Amendment applies when the government does this. And what I've been wondering about is, what's the meaning of the court's decision in Carpenter in June 2018 that said, if the government is gathering a large amount of cellular location information about somebody, that infringes privacy because you can learn so much about somebody by the places that they go, who they visit.
Mm-hmm. So I'll take the second one first, which, yes, I think that once it's involuntary, and of course, if the government is involved, then we do have a Fourth Amendment question. Carpenter and Jones, I think, are probably the two most important cases. Carpenter being location data, quite a lot of location data, and Jones being sort of similar, but tracking someone around for a while with the GPS locator in their car. So the court would have to consider, first of all, whether this is as invasive as those kinds of collections. So if it's the Bluetooth data, it's proximity data, not location data. I don't know that they've considered something like that before. So that's one question. They'd probably even need to consider whether it's a search. Now there is a court in Illinois that found that granular smart grid data, collecting that was a search, although it said that it was justified. So there are some courts that are thinking kind of creatively and broadly about what kind of collection would be a search. But smart grid data identifies you, this data maybe wouldn't identify you. So in short, I think it would depend a lot on the specifics of what's being collected by whom, and how the court chooses to compare that to existing cases. And then, of course, the question of whether there's administrative exception, that kind of thing, which I am not qualified to say anything to you about, Erwin. And then on the first question, what is consent? This is a very important question. So whether or not the app is voluntary vis-a-vis public health officials and contact tracing, you are exactly right that employers or stores or country clubs or any number of private organizations may wish to require people to download and use the app in order to do various things. The Democrats' bill has some limitations on employee tracking. The Republicans' bill does not. Both of them, however, have exceptions for reasonable uses. So, for example, keeping the rest of your employees safe. I don't know exactly what would come of that, but I do know that it creates very thorny equity issues and non-discrimination issues, along with, of course, the very important public health issues and economic issues that lead people towards wanting to use these kinds of proximity trackers in the workplace or in a store.
Okay. So someone said, thank you so much. That was a great talk. My question is, what do you think the bottom line is in terms of whether we will derive any meaningful public health benefits from these apps? Your talk makes me feel discouraged. The basic problem is actually the low level of public trust. Make it voluntary and people won't adopt it. Make it mandatory and that will create more distrust. And there is no way to effectively enforce compulsory downloads anyways. A couple of countries that have used these and had some success, Singapore and South Korea, have done so as part of much more aggressive approach to data gathering that is hard to imagine here.
So I would say have hope. Maybe don't place it in a Google Apple app. We'd like things to be easy. We would like things to be cheap. We would really like things to be more privacy protective than traditional contact tracing. But maybe or maybe not, there are ways to improve the efficacy of these kinds of contact tracing apps. But if not, we know how to do contact tracing and we simply need to invest in it, number one. Actually, number two. Number one, we need to invest in testing. And we need to create the environment such that we are actually able to have sufficient information for people to make good decisions. Now, does that mean that it will be easy? No, I don't think so. I think that those numbers are really hard numbers. This is a contagious disease and it has a number of characteristics that make it really difficult. The asymptomatic transmission, for example, the fact that it has a fairly long incubation period, these things just make it difficult. But we do have ways of improving the situation, even if it isn't through an app.
Great. I don't have any other pending questions, so I think that's it.
Great. Thanks everybody for, it's nice to see everyone once in a while, and I appreciate the time. Drew, I will write to you with the various attacks that you can do.
Thank you so much, Jennifer, for doing this. It was just terrific.
All right, great. So I think we'll wrap this up and we'll see everyone next Monday for our next panel. Thank you.